Hey, Alphanesses, I'm Messenger from alphanesguy.com. This is 150 practice NCLEX questions. Without delay, let's get started.
The medication prescribed is digoxin, 0.25 milligrams orally, daily. The medication label reads digoxin, 0.125 milligrams per 1 tablet. The nurse should prepare how many tablet to administer the dose. A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. The correct answer is B. 2 tablets. Rationale: the formula for this question is desired times quantity over on hand equals to tablets per dose. So in this question, desired is 0.25 milligrams, quantity is 1 tablet, on hand is 0.125 milligrams. You plug these numbers into the formula, so 0.25 milligrams times 1 tablet over 0.125 milligrams equals to 2 tablets. The nurse is preparing to administer furosemide to a client with a diagnosis of heart failure. Which is the most important laboratory test result for the nurse to review before administering this medication? A. Potassium level. B. Creatinine level. C. Cholesterol level. D. Blood urea nitrogen. The correct answer is A. Potassium level. Rationale: furosemide is a loop diuretic. The medication causes a decrease in the client's electrolytes, especially potassium, sodium, and chloride. Administering furosemide to a client with a low potassium level could precipitate ventricular dysrhythmias. The options of blood urea nitrogen and creatinine reflect renal function. The cholesterol level is unrelated to the administration of this medication. The medication prescribed is hydromorphone hydrochloride, 3 mg intramuscularly, every 4 hours as needed. The medication label reads hydromorphone hydrochloride, 4 mg per 1 milliliter. The nurse should prepare to administer how many milliliter to the client? A. 0.70 milliliters. B. 0.50 milliliters. C. 0.75 milliliters. D. 0.80 milliliters. The correct answer is C. 0.75 milliliters. Rationale: the formula for this question is desired times quantity over on hand equals to milliliter per dose. So in this question, desired is 3 milligrams, quantity is 1 milliliter, on hand is 4 milligrams. You plug these numbers into the formula, so 3 milligrams times 1 milliliter over 4 milligrams equals to 0.75 milliliters. The nurse reinforces dietary instructions to a client who will be taking warfarin sodium. The nurse tells the client to avoid which food item? A. Grapes. B. Spinach. C. Watermelon. D. Cottage cheese. The correct answer is B. Spinach. Rationale: warfarin sodium is an anticoagulant. Anticoagulant medications act by antagonizing the action of vitamin K, which is needed for clotting. When a client is taking an anticoagulant, foods high in vitamin K often are omitted from the diet. Vitamin K-rich foods include green, leafy vegetables, fish, liver, coffee, and tea. The intravenous prescription is 1,000 milliliters of 0.9% sodium chloride to run over 12 hours. The drop factor is 15 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute? Round the answer to the nearest whole number. A. 18 drops per minute. B. 19 drops per minute. C. 20 drops per minute. D. 21 drops per minute. The correct answer is D. 21 drops per minute. Rationale: the prescribed 1,000 milliliters is to be infused over 12 hours. Follow the formula and multiply 1,000 milliliters by 15. Then divide the result by 720 minutes. The infusion is to run at 20.8 or 21 drops per minute.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Rifabutin is prescribed for a client with active Mycobacterium avium complex disease and tuberculosis. The nurse should monitor for which side/adverse effects of the medication. Select all that apply. A. Signs of hepatitis. B. Flu-like syndrome. C. Low neutrophil count. D. Vitamin B6 deficiency. E. Ocular pain or blurred vision. F. Tingling and numbness of the fingers. The correct answers are A. Signs of hepatitis, B. Flu-like syndrome, C. Low neutrophil count, and E. Ocular pain or blurred vision. Rationale: Rifabutin may be prescribed for a client with active MAC disease and tuberculosis. It inhibits mycobacterial DNA-dependent RNA polymerase and suppresses protein synthesis. Side effects include rash, gastrointestinal disturbances, neutropenia, red-orange body secretions, uveitis, myositis, arthralgia, hepatitis, chest pain with dyspnea, and flu-like syndrome. Vitamin B6 deficiency and numbness and tingling in the extremities are associated with the use of isoniazid. Ethambutol also causes peripheral neuritis. A client is taking ticlopidine hydrochloride. The nurse tells the client to avoid which substance while taking this medication? A. Vitamin C. B. Vitamin D. C. Acetaminophen. D. Acetylsalicylic acid. The correct answer is D. Acetylsalicylic acid. Rationale: Ticlopidine hydrochloride is a platelet aggregation inhibitor. It is used to decrease the risk of thrombotic strokes in clients with precursor symptoms. Because it is an antiplatelet agent, other medications that precipitate or aggravate bleeding should be avoided during its use. Therefore, aspirin or any aspirin-containing product should be avoided. An antihypertensive medication has been prescribed for a client with hypertension. The client tells the nurse that she would like to take an herbal substance to help lower her blood pressure. Which statement by the nurse is the most important to provide to the client? A. Herbal substances are not safe and should never be used. B. I will teach you how to take your blood pressure so that it can be monitored closely. C. You will need to talk to your healthcare provider before using an herbal substance. D. If you take an herbal substance, you will need to have your blood pressure checked frequently. The correct answer is C. You will need to talk to your healthcare provider before using an herbal substance. Rationale: although herbal substances may have some beneficial effects, not all herbs are safe to use. Clients who are being treated with conventional medication therapy should be advised to avoid herbal substances with similar pharmacological effects, because the combination may lead to an excessive reaction or unknown interaction effects. Therefore, the nurse would advise the client to discuss the use of the herbal substance with the healthcare provider. The nurse is caring for a client who is taking metoprolol. The nurse measures the client's blood pressure and apical pulse immediately before administration. The client's BP is 122/78 mm of mercury, and the apical pulse is 58 beats per minute. Based on this data, which is the appropriate action? A. Withhold the medication. B. Notify the healthcare provider immediately. C. Administer the medication as prescribed. D. Administer half of the prescribed medication. The correct answer is A. Withhold the medication. Rationale: metoprolol is classified as a beta-adrenergic blocker and is used in the treatment of hypertension, angina, and myocardial infarction. Baseline nursing assessments include measurement of BP and apical pulse immediately before administration. If the systolic BP is below 90 mm of mercury and the apical pulse is below 60 beats per minute, the nurse should withhold the medication and document this action. The medication prescribed is heparin sodium, 650 units subcutaneously, every 12 hours. The medication vial reads heparin sodium, 1000 units per 1 milliliter. The nurse prepares how many milliliters to administer one dose? A. 6.50 milliliters. B. 0.65 milliliters. C. 650 milliliters. D. 6,500 milliliters. The correct answer is B. 0.65 milliliters. Rationale: the formula for this question is desired times quantity over on hand equals to milliliter per dose. So in this question, desired is 650 units, quantity is 1 milliliter, on hand is 1000 units. You plug these numbers into the formula, so 650 units times 1 milliliter over 1000 units equals to 0.65 milliliters. A client has a prescription to take guaifenesin every 4 hours as needed. The nurse determines that the client understands the most effective use of this medication if the client makes which statement? A. I will watch for irritability as a side effect. B. I will take the tablet with a full glass of water. C. I will take an extra dose if the cough is accompanied by fever. D. I will crush the sustained release tablet if immediate relief is needed. The correct answer is B. I will take the tablet with a full glass of water. Rationale: guaifenesin is an expectorant. It should be taken with a full glass of water to decrease viscosity of secretions. Sustained release preparations should not be broken open, crushed, or chewed. The medication may occasionally cause dizziness, headache, or drowsiness as side effects. The client should contact the healthcare provider if the cough lasts longer than 1 week, or is accompanied by fever, rash, sore throat, or persistent headache. The nurse prepares to administer digoxin to a 3-year-old with a diagnosis of heart failure, and notes that the apical heart rate is 120 beats per minute. Which nursing action is appropriate? A. Hold the medication. B. Administer the digoxin. C. Notify the healthcare provider. D. Recheck the apical heart rate in 15 minutes. The correct answer is B. Administer the digoxin. Rationale: the normal apical heart rate for a 3-year-old is 80 to 125 beats per minute. Because the apical heart rate is within normal range, options A, C, and D are inappropriate. The intravenous prescription is 3,000 milliliters of 5% dextrose to run over a 24-hour period. The drop factor is 10 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute? Round the answer to the nearest whole number. A. 19 drops per minute. B. 20 drops per minute. C. 21 drops per minute. D. 22 drops per minute. The correct answer is C. 21 drops per minute. Rationale: the prescribed 3,000 milliliters is to be infused over 24 hours. Follow the formula and multiply 3,000 milliliters by 10. Then divide the result by 1,440 minutes. The infusion is to run at 20.8 or 21 drops per minute. A postoperative client has received a dose of naloxone hydrochloride for respiratory depression shortly after transfer to the nursing unit from the post-anesthesia care unit. After administration of the medication, the nurse should check the client for which sign/symptom? A. Pupillary changes. B. Scattered lung wheezes. C. Sudden increase in pain. D. Sudden episodes of diarrhea. The correct answer is C. Sudden increase in pain. Rationale: naloxone hydrochloride is an antidote to opioids and may also be given to the postoperative client to treat respiratory depression. When given to the postoperative client for respiratory depression, it may also reverse the effects of analgesics. Therefore, the nurse must check the client for a sudden increase in the level of pain experienced. Options A, B, and D are not associated with this medication. The nurse notes that a client in a long-term care facility is receiving a daily dose of furosemide. The nurse writes in the care plan to monitor which parameter on a daily basis. A. Weight. B. Radial pulse. C. Hemoglobin. D. Serum creatinine clearance. The correct answer is A. Weight. Rationale: daily weight should be monitored because this reflects the fluid status of the client who is receiving a diuretic. Option B is a general assessment and does not relate directly to fluid balance. Option C and D are laboratory measurements that are not prescribed routinely by the nurse and would not be done on a daily basis in a long-term care facility.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse reviews a client's electrolyte results and notes a potassium level of 5.5 milliequivalents per liter. The nurse understands that a potassium value at this level should be noted with which condition? A. Diarrhea. B. Traumatic burn. C. Cushing's syndrome. D. Overuse of laxatives. The correct answer is B. Traumatic burn. Rationale: a serum potassium level that exceeds 5.0 milliequivalents per liter is indicative of hyperkalemia. Clients who experience the cellular shifting of potassium, as in the early stages of massive cell destruction, are at risk for hyperkalemia. The client with Cushing's syndrome, or diarrhea, and the client who has been overusing laxatives are at risk for hypokalemia. A client has been given a prescription for gemfibrozil. The nurse plans to instruct the client to limit intake of which food while taking this medication? A. Fish. B. Beef. C. Spicy foods. D. Citrus products. The correct answer is B. Beef. Rationale: gemfibrozil is a lipid-lowering agent. It is given as part of a therapeutic regimen that also includes dietary counseling, specifically the limitation of saturated and other fats in the diet. Therefore, the intake of red meats is limited. Fish, foods that are spicy, and citrus products do not affect the cholesterol level. The nurse reviews a client's electrolyte results and notes that the potassium level is 5.4 milliequivalents per liter. Which of the following should the nurse observe on the cardiac monitor as a result of this laboratory value? A. ST elevation. B. Peaked P waves. C. Prominent U waves. D. Narrow, peaked T waves. The correct answer is D. Narrow, peaked T waves. Rationale: a serum potassium level of 5.4 milliequivalents per liter is indicative of hyperkalemia. Cardiac changes include a wide, flat P wave, a prolonged PR interval, a widened QRS complex, and narrow, peaked T waves. A potassium-retaining diuretic is prescribed for a client with heart failure. Which foods should the nurse instruct the client to avoid? A. Plums. B. Bananas. C. Cranberry juice. D. Cheddar cheese. The correct answer is B. Bananas. Rationale: when the client is taking a potassium-retaining diuretic, the client should avoid foods high in potassium. A banana contains 451 milligrams of potassium. Cranberry juice contains 61 milligrams of potassium. A plum contains 48 milligrams of potassium, and 1 ounce of cheddar cheese contains 28 milligrams of potassium. A client has been taking isoniazid for 2 months. The client complains to the nurse about numbness, paresthesias, and tingling in the extremities. The nurse interprets that the client is experiencing which problem? A. Hypercalcemia. B. Peripheral neuritis. C. Small blood vessel spasm. D. Impaired peripheral circulation. The correct answer is B. Peripheral neuritis. Rationale: a common adverse effect of isoniazid is peripheral neuritis. This is manifested by numbness, tingling, and paresthesias in the extremities. This adverse effect can be minimized by pyridoxine intake. Options A, C, and D are incorrect. A client is receiving a continuous intravenous infusion of heparin in the treatment of deep vein thrombosis. The nurse is told that the client's activated partial thromboplastin time level is 65 seconds, and that the client's baseline before the initiation of therapy was 30 seconds. The nurse identifies these results as characteristic of which description? A. Low. B. Elevated. C. Abnormal. D. Within the therapeutic range. The correct answer is D. Within the therapeutic range. Rationale: the normal activated partial thromboplastin time varies between 20 and 36 seconds, depending on the type of activator used in testing. The therapeutic dose of heparin for treatment of deep vein thrombosis is to keep the activated partial thromboplastin time between 1.5 and 2.5 times normal. Thus, the client's activated partial thromboplastin time is within the therapeutic range, and the dose should remain unchanged. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for a potassium deficit. A. The client with Addison's disease. B. The client with metabolic acidosis. C. The client with intestinal obstruction. D. The client receiving nasogastric suction. The correct answer is D. The client receiving nasogastric suction. Rationale: potassium-rich gastrointestinal fluids are lost through GI suction, which places the client at risk for hypokalemia. The client with intestinal obstruction, Addison's disease, and metabolic acidosis is at risk for hyperkalemia. A client with chronic atrial fibrillation is being started on amiodarone as maintenance therapy for dysrhythmia suppression. The nurse reinforces instructions to the client about the medication. Which statement by the client indicates a need for further teaching? A. I will need to have routine follow-up with my ophthalmologist. B. I will need to use sunscreen and protective clothing when outside. C. I will periodically have blood drawn to monitor my thyroid function. D. I will stop taking the prescribed anticoagulant after starting this new medication. The correct answer is D. I will stop taking the prescribed anticoagulant after starting this new medication. Rationale: amiodarone is used for the dysrhythmia, atrial fibrillation. The medication will have no effect in preventing thrombus formation within the atria, so anticoagulants need to be continued. The medication increases sun sensitivity, so protective measures are essential. Thyroid function studies should be monitored because the medication can affect thyroid function. Because the medication can cause corneal microdeposits, follow-up with the ophthalmologist is important. The nurse who is caring for a client with kidney failure notes that the client is dyspneic, and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? A. Rapid weight loss. B. Flat hand and neck veins. C. Weak and thready pulse. D. Increase in blood pressure. The correct answer is D. An increase in blood pressure. Rationale: impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, and elevated blood pressure, abounding pulse, and elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level. A child is scheduled for a tonsillectomy. Which should present the highest risk of aspiration during surgery? A. Difficulty swallowing. B. Bleeding during surgery. C. Exudate in the throat area. D. The presence of loose teeth. The correct answer is D. The presence of loose teeth. Rationale: in the preoperative period, the child should be observed for the presence of loose teeth to decrease the risk of aspiration during surgery. Bleeding during surgery will be controlled via packing and suction as needed. The nurse is reinforcing instructions to the mother of an 8-year-old child who had a tonsillectomy. The mother tells the nurse that the child loves tacos and asks when the child can safely eat one. The nurse should make which response to the mother? A. In 1 week. B. In 3 weeks. C. 2 days following surgery. D. When the healthcare provider says it's okay. The correct answer is B. In 3 weeks. Rationale: rough, scratchy foods or spicy foods are to be avoided for 3 weeks. Citrus juices, which irritate the throat, need to be avoided for 10 days. Red liquids are avoided because they will give the appearance of blood if the child vomits. A full liquid diet is allowed on the second postoperative day, and soft foods are allowed as the child tolerates them. The nurse is reviewing the laboratory results of a child scheduled for tonsillectomy. Which laboratory value would be significant to review? A. Creatinine. B. Urinalysis. C. Platelet count. D. Blood urea nitrogen. The correct answer is C. Platelet count. Rationale: before the surgical procedure, the child is assessed for signs of active infection and for redness and exudate of the throat. Because the tonsillar area is so vascular, postoperative bleeding is a concern. The platelet count result would identify a potential for bleeding. The blood urea nitrogen and creatinine would not determine the potential for bleeding, but rather evaluate renal function. The nurse is monitoring a child following a tonsillectomy. Which finding would indicate that the child is bleeding? A. Restlessness. B. A decreased pulse rate. C. Complaints of discomfort. D. An elevation in blood pressure. The correct answer is A. Restlessness. Rationale: frequent swallowing, restlessness, a fast and thready pulse, and vomiting bright red blood are signs of bleeding. An elevated blood pressure is not an indication of bleeding. Complaint of discomfort is an expected finding following a tonsillectomy. The nurse is caring for a 2-year-old child diagnosed with croup. The nurse collects data on the child, knowing that which is characteristic of this illness. Select all that apply. A. The cough is harsh and metallic. B. Inspiratory stridor may be present. C. Symptoms usually worsen at night and are better during the day. D. Symptoms usually worsen during the day and are relieved during sleep. E. It is usually preceded by several days of upper respiratory infection symptoms. The correct answers are A. The cough is harsh and metallic. B. Inspiratory stridor may be present. C. Symptoms usually worsen at night and are better during the day. And E. It is usually preceded by several days of upper respiratory infection symptoms. Rationale: croup often begins at night and may be preceded by several days of upper respiratory infection symptoms. It is characterized by a sudden onset of a harsh, metallic cough, sore throat, and inspiratory stridor. Symptoms usually worsen at night and are better in the day. A child with croup is being discharged from the hospital. The nurse reinforces home care instructions to the mother and advises the mother to bring the child to the emergency department if the child develops which symptom? A. Stridor. B. Irritability. C. Tiredness. D. Poor fluid intake. The correct answer is A. Stridor. Rationale: the mother should be instructed to bring the child to the emergency department if the child develops stridor at rest, cyanosis, severe agitation, or fatigue, moderate to severe retractions, or is unable to take oral fluids.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A hospitalized 2-year-old child with croup is receiving corticosteroid therapy. The mother asks the nurse why the healthcare provider did not prescribe antibiotics. The nurse makes which response to the mother? A. The child may be allergic to antibiotics. B. The child is too young to receive antibiotics. C. Antibiotics are not indicated unless a bacterial infection is present. D. The child still has the maternal antibodies from birth and does not need antibiotics. The correct answer is C. Antibiotics are not indicated unless a bacterial infection is present. Rationale: antibiotics are not indicated in the treatment of croup unless a bacterial infection is present. For answer choice A, the question does not include any supporting data to indicate that the child may be allergic to antibiotics. A mother arrives at the emergency department with her child, and a diagnosis of epiglottitis is documented. Which of the healthcare provider's prescription should the nurse question? A. Obtain a throat culture. B. Obtain axillary temperatures. C. Administer humidified oxygen. D. Administer antipyretics for fever. The correct answer is A. Obtain a throat culture. Rationale: the throat of a child with suspected epiglottitis should not be examined or cultured because any stimulation with a tongue depressor or culture swab could cause laryngospasm and complete airway obstruction. Humidified oxygen and antipyretics are components of the treatment. Axillary, rather than oral temperatures, should be taken. The emergency department nurse is gathering initial data on a child suspected of epiglottitis. Which is the nurse's highest priority? A. Check for a patent airway. B. Prepare the child for an X-ray. C. Prepare the child for tracheotomy. D. Assist the healthcare provider with intubation. The correct answer is A. Check for a patent airway. Rationale: when epiglottitis is suspected, the priorities are to maintain a patent airway and to next obtain an X-ray to confirm the diagnosis. If epiglottitis is present, the child is taken promptly to the operating room for tracheal intubation. Although options B, C, and D may be components of care, they are not the priority. The nurse caring for an infant with bronchiolitis is monitoring for signs of dehydration. The nurse monitors which method as reliable for determining fluid loss? A. Intake. B. Output. C. Skin turgor. D. Body weight. The correct answer is D. Body weight. Rationale: body weight is the most reliable method of measurement of body fluid loss or gain. 1 kilogram of weight change represents 1 liter of fluid loss or gain. Although options A, B, and C may be used to determine fluid status, they are not the most reliable determinants. The nurse is collecting data from a client who is pregnant with triplets. The client also has a 3-year-old child who was born at 39 weeks gestation. The nurse should document which gravida and para status on this client. A. Gravida 1, para 1. B. Gravida 2, para 1. C. Gravida 2, para 2. D. Gravida 3, para 2. The correct answer is B. Gravida 2, para 1. Rationale: gravida is a term that refers to a woman who is or who has been pregnant, regardless of the duration of the pregnancy. Parity is a term that means the number of births after 20 weeks gestation. It does not reflect the number of fetuses or infants. The nurse is reviewing the record of a client who has just been told that her pregnancy test is positive. The nurse notes that the healthcare provider has documented the presence of Goodell's sign. The nurse determines that this sign is indicative of which? A. A softening of the cervix. B. The presence of fetal movement. C. The presence of human chorionic gonadotropin in the urine. D. A soft blowing sound that corresponds with the maternal pulse that is heard while auscultating the uterus. The correct answer is A. A softening of the cervix. Rationale: during the early weeks of pregnancy, the cervix becomes softer as a result of pelvic vasoconstriction, which causes Goodell's sign. Cervical softening is noted by the examiner during a pelvic examination. Goodell's sign does not indicate the presence of fetal movement. Human chorionic gonadotropin is noted in maternal urine, with a positive urine pregnancy test. A soft blowing sound that corresponds with the maternal pulse may be auscultated over the uterus. It is the result of blood circulating through the placenta. A premipara is being evaluated in the clinic during her second trimester of pregnancy, which indicates an abnormal physical finding that necessitates further testing. A. Quickening. B. Braxton Hicks contractions. C. Consistent increase in fundal height. D. Fetal heart rate of 180 beats per minute. The correct answer is D. Fetal heart rate of 180 beats per minute. Rationale: the fetal heart rate depends on the gestational age. It is 160 to 170 beats per minute during the first trimester, and it slows with fetal growth to approximately 120 to 160 beats per minute. Options A, B, and C are normal expected findings. The nurse is collecting data from a pregnant client who is at 28 weeks gestation. The nurse measures the fundal height in centimeters and should expect which finding? A. 22 centimeters. B. 28 centimeters. C. 36 centimeters. D. 40 centimeters. The correct answer is B. 28 centimeters. Rationale: during the second and third trimesters, the fundal height in centimeters approximately equals the fetus's age in weeks plus or minus 2 centimeters. At 14 to 16 weeks gestation, the fundus can be located halfway between the symphysis pubis and the umbilicus. At 20 to 22 weeks gestation, the fundus is at the umbilicus, and at term, the fundus is at the xiphoid process. A pregnant client is seen in the healthcare clinic for a regular prenatal visit. The client tells the nurse that she is experiencing irregular contractions. The nurse determines that the client is experiencing Braxton Hicks contractions. Based on this finding, which nursing action is appropriate? A. Contact the healthcare provider. B. Instruct the client to maintain bed rest for the remainder of the pregnancy. C. Tell the client that these are common, and they may occur throughout the pregnancy. D. Call the maternity unit and inform them that the client will be admitted in a pre-labor condition. The correct answer is C. Tell the client that these are common, and they may occur throughout the pregnancy. Rationale: Braxton Hicks contractions are irregular, painless contractions that may occur intermittently throughout pregnancy. Braxton Hicks contractions are normal in some pregnant women during pregnancy. The nurse is collecting data from a client who suspects she is pregnant. The nurse is checking the client for probable signs of pregnancy. Which are the probable signs of pregnancy that the nurse should note? Select all that apply. A. Ballottement. B. Chadwick's sign. C. Uterine enlargement. D. Braxton Hicks contractions. E. Outline of fetus via radiography or ultrasound. F. Fetal heart rate detected by a non-electronic device. The correct answers are A. Ballottement, B. Chadwick's sign, C. Uterine enlargement, and D. Braxton Hicks contractions. Rationale: the probable signs of pregnancy include uterine enlargement, Hagar's sign, which is the compressibility and softening of the lower uterine segment that occurs at about week 6. Goodell's sign, which is the softening of the cervix that occurs at the beginning of the second month of pregnancy. Chadwick's sign, which is the violet coloration of the mucous membranes of the cervix, vagina, and vulva that occurs at about week 4. Ballottement, which is the rebounding of the fetus against the examiner's fingers on palpation. And Braxton Hicks contractions. The nursing instructor asks a nursing student to describe the process of quickening. Which statement indicates an understanding of this term? A. It is the fetal movement that is felt by the mother. B. It is the compressibility of the lower uterine segment. C. It is the irregular, painless contractions that occur throughout pregnancy. D. It is the soft blowing sound that can be heard when the uterus is auscultated. The correct answer is A. It is the fetal movement that is felt by the mother. Rationale: Quickening is fetal movement that appears, usually at week 16 to 20, when the expectant mother first notices subtle fetal movements that gradually increase in intensity. A compressibility of the lower uterine segment occurs at about 6 weeks gestation and is called Hagar's sign. Braxton Hicks contractions are irregular, painless contractions that may occur throughout pregnancy. A soft blowing sound that corresponds with the maternal pulse may be auscultated over the uterus. This is known as uterine souffle. This sound is the result of blood circulation to the placenta, and it corresponds with the maternal pulse. The client is undergoing an amniocentesis at 16 weeks gestation to detect the presence of biochemical or chromosomal abnormalities. Which instructions should the nurse reinforce to the client? A. The bladder must be full during the exam. B. The bladder must be empty during the exam. C. She will be given RhoGAM because she is Rh positive. D. Do not eat or drink anything 4 to 6 hours before the exam. The correct answer is A. The bladder must be full during the exam. Rationale: before 20 weeks gestation, the bladder must be kept full during amniocentesis to support the weight of the uterus. After 20 weeks gestation, the bladder should be emptied to minimize the chance of puncturing the placenta or fetus. Rho immune globulin is administered to Rh-negative women because of the risk of contact with the fetal blood during the exam. There are no fluid or food restrictions. Monitoring the fetal heart tones and the vital signs throughout and after the exam is an important intervention. The client at 28 weeks gestation is Rh negative and Coombs antibody negative. The nurse determines that the client understands what the nurse has taught her about Rh sensitization when the client makes which statement? A. I know I can never have another child. B. I am glad I won't have to have these shots if I have another child. C. I will have to have an injection once a month until the baby is born. D. I will tell the nurse at the hospital that I had RhoGAM during pregnancy. The correct answer is D. I will tell the nurse at the hospital that I had RhoGAM during pregnancy. Rationale: as described in the question, it is accepted practice to administer Rho immune globulin to an Rh-negative woman at 28 weeks gestation, with a second injection within 72 hours of delivery. This prevents sensitization, which could jeopardize a future pregnancy. For subsequent pregnancies or abortions, the injections must be repeated because the immunity is passive. While assisting with the measurement of fundal height, the client at 36 weeks gestation states that she is feeling lightheaded. On the basis of the nurse's knowledge of pregnancy, the nurse determines that this is most likely a result of which? A. A full bladder. B. Emotional instability. C. Insufficient iron intake. D. Compression of the vena cava. The correct answer is D. Compression of the vena cava. Rationale: compression of the inferior vena cava and aorta by the uterus may cause supine hypotension syndrome during pregnancy. Having the woman turn onto her left side, or elevating the right buttock during fundal height measurement will prevent or correct the problem. Following a group therapy session, a client approaches the nurse and verbalizes a need for seclusion because of uncontrollable feelings. The nurse reports the findings to the charge nurse and expects that the charge nurse will take which action? A. Call the client's family. B. Place the client in seclusion immediately. C. Inform the client that seclusion has not been prescribed. D. Get a written prescription from the healthcare provider and obtain an informed consent. The correct answer is D. Get a written prescription from the healthcare provider and obtain an informed consent. Rationale: a client may request to be secluded or restrained. Federal laws require the consent of the client unless an emergency situation exists, in which an immediate risk to the client or others can be documented. The use of seclusion and restraint is permitted only on the written prescription of the healthcare provider, which must be reviewed and renewed every 24 hours, depending on state law requirements. It must also specify the type of restraint to be used.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is providing care to a client admitted to the hospital with a diagnosis of anxiety disorder. The nurse is talking with the client, and the client says, "I have a secret that I want to tell you. You won't tell anyone about it, will you?" Which is the appropriate nursing response? A. No, I won't tell anyone. B. I cannot promise to keep a secret. C. If you tell me the secret, I will tell it to your doctor. D. If you tell me the secret, I will need to document it in your record. The correct answer is B. I cannot promise to keep a secret. Rationale: the nurse should never promise to keep a secret. Secrets are appropriate in a social relationship but not in a therapeutic one. The nurse needs to be honest with the client and tell the client that a promise cannot be made to keep the secret. A client with delirium becomes agitated and confused at night. The best initial intervention by the nurse is which? A. Move the client next to the nurse's station. B. Use a night light and turn off the television. C. Keep the television and a soft light on during the night. D. Play soft music during the night and maintain a well-lit room. The correct answer is B. Use a night light and turn off the television. Rationale: it is important to provide a consistent daily routine and a low-stimulation environment when the client is agitated and confused. Noise levels including a radio and television may add to the confusion and disorientation. Moving the client next to the nurse's station is not the initial intervention. Which nursing interventions are appropriate for a hospitalized client with mania who is exhibiting manipulative behavior? Select all that apply. A. Communicate expected behaviors to the client. B. Enforce rules and inform the client that he or she will not be allowed to attend therapy groups. C. Assist the client in developing means of setting limits on personal behavior. D. Follow through about the consequences of behavior in a non-punitive manner. F. Be clear with the client regarding the consequences of exceeding limits set regarding behavior. The correct answers are A. Communicate expected behaviors to the client. C. Assist the client in developing means of setting limits on personal behavior. D. Follow through about the consequences of behavior in a non-punitive manner. And F. Be clear with the client regarding the consequences of exceeding limits set regarding behavior. Rationale: interventions for dealing with the client exhibiting manipulative behavior include setting clear, consistent, and enforceable limits on manipulative behaviors, being clear with the client regarding the consequences of exceeding limits set, following through with the consequences in a non-punitive manner, and assisting the client in developing means of setting limits on personal behaviors. Enforcing rules and informing the client that he or she will not be allowed to attend therapy groups are violations of a client's rights. The nurse observes that a client is psychotic, pacing, and agitated and is making aggressive gestures. The client's speech pattern is rapid and the client's affect is belligerent. Based on these observations, the nurse's immediate priority of care is which? A. Provide safety for the client and other clients on the unit. B. Provide the clients on the unit with a sense of comfort and safety. C. Assist the staff in caring for the client in a controlled environment. D. Offer the client a less stimulating area to calm down and gain control. The correct answer is A. Provide safety for the client and other clients on the unit. Rationale: safety of the client and other clients is the priority. Option A is the only option that addresses the client and other clients' safety needs. Option D addresses the client's needs. Option B addresses other clients' needs. Option C is not client-centered. The nurse is caring for a client diagnosed with catatonic stupor. The client is lying on the bed, with the body pulled into a fetal position. The appropriate nursing intervention is which? A. Ask direct questions to encourage talking. B. Leave the client alone and intermittently check on him. C. Sit beside the client in silence and verbalize occasional open-ended questions. D. Take the client into the dayroom with other clients so they can help watch him. The correct answer is C. Sit beside the client in silence and verbalize occasional open-ended questions. Rationale: clients with catatonic stupor may be immobile and mute and may require consistent, repeated approaches. The nurse facilitates communication with the client by sitting in silence, asking open-ended questions, and pausing to provide opportunities for the client to respond. The nurse would not leave the client alone. Option D relies on other clients to care for this one, which is an inappropriate expectation. Asking direct questions of this client is not therapeutic. Option C is the best action because it provides for client supervision and communication as appropriate. A mother of a teenage client with an anxiety disorder is concerned about her daughter's progress on discharge. She states that her daughter stashes food, eats all the wrong things that make her hyperactive, and hangs out with the wrong crowd. In helping the mother prepare for her daughter's discharge, the nurse should suggest which? A. The mother should restrict the daughter's socializing time with her friends. B. The mother should restrict the amount of chocolate and caffeine products in the home. C. The mother should keep her daughter out of school until she can adjust to the school environment. D. The mother should consider taking time from work to help her daughter readjust to the home environment. The correct answer is B. The mother should restrict the amount of chocolate and caffeine products in the home. Rationale: clients with anxiety disorder should abstain from or limit their intake of caffeine, chocolate, and alcohol. These products have the potential of increasing anxiety. Options 1 and 3 are unreasonable and are an unhealthy approach. It may not be realistic for a family member to take time away from work. A client has reported that crying spells have been a major problem over the past several weeks, and that the doctor said depression is probably the reason. The nurse observes that the client is sitting slumped in the chair, and the clothes that the client is wearing do not fit well. The nurse interprets that further data collection should focus on which? A. Weight loss. B. Sleep patterns. C. Medication compliance. D. Onset of the crying spells. The correct answer is A. Weight loss. Rationale: all the options are possible issues to address, however, the weight loss is the first item that needs further data collection because ill-fitting clothing could indicate a problem with nutrition. The client has already told the nurse that the crying spells have been a problem. Medication or sleep patterns are not mentioned or addressed in the question. The nursing student is developing a plan of care for the hospitalized client with bulimia nervosa. The nursing instructor intervenes if the student documents which incorrect intervention in the plan. A. Monitor intake and output. B. Monitor electrolyte levels. C. Observe for excessive exercise. D. Monitor for the use of laxatives and diuretics. The correct answer is C. Observe for excessive exercise. Rationale: excessive exercise is a characteristic of anorexia nervosa, not bulimia nervosa. Frequent vomiting, in addition to laxative and diuretic abuse, may lead to dehydration and electrolyte imbalance. Monitoring for both dehydration and electrolyte imbalance is an important nursing action. Option 3 is the only option that is not associated with care of the client with bulimia. The nurse is caring for a female client who was recently admitted to the hospital for anorexia nervosa. The nurse enters the client's room and notes that the client is doing vigorous push-ups. Which nursing action is appropriate? A. Interrupt the client and weigh her immediately. B. Interrupt the client and offer to take her for a walk. C. Allow the client to complete her exercise program. D. Tell the client that she is not allowed to exercise vigorously. The correct answer is B. Interrupt the client and offer to take her for a walk. Rationale: clients with anorexia nervosa are frequently preoccupied with vigorous exercise and push themselves beyond normal limits to work off caloric intake. The nurse must provide for appropriate exercise as well as place limits on vigorous activities. Methylergonavine is prescribed for a woman to treat postpartum hemorrhage. Before the administration of methylergonavine, the nurse should check which priority item. A. Uterine tone. B. Blood pressure. C. Amount of lochia. D. Deep tendon reflexes. The correct answer is B. Blood pressure. Rationale: methylergonavine, which is an ergot alkaloid, is an agent that is used to prevent or control postpartum hemorrhage by contracting the uterus. Methylergonavine causes continuous uterine contractions and may elevate the blood pressure. A priority before the administration of the medication is to check the blood pressure. The healthcare provider should be notified if hypertension is present. Although options A, C, and D may be components of the postpartum data collection procedures, option B is related specifically to the administration of this medication. The nurse is monitoring a preterm labor client who is receiving magnesium sulfate intravenously. The nurse should monitor for which adverse effects of this medication. Select all that apply. A. Flushing. B. Hypertension. C. Increased urine output. D. Depressed respirations. E. Extreme muscle weakness. F. Hyperactive deep tendon reflexes. The correct answers are A. Flushing, D. Depressed respirations, and E. Extreme muscle weakness. Rationale: magnesium sulfate is a central nervous system depressant, and it relaxes smooth muscle, including the uterus. It is used to stop preterm labor contractions, and it is used for preeclamptic clients to prevent seizures. Adverse effects include flushing, depressed respirations, depressed deep tendon reflexes, hypotension, extreme muscle weakness, decreased urine output, pulmonary edema, and elevated serum magnesium levels. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determines that the client is experiencing toxicity from the medication if which is noted on data collection. A. Proteinuria of 3+. B. Presence of deep tendon reflexes. C. Serum magnesium level of 6 milliequivalents per liter. D. Respirations of 10 breaths per minute. The correct answer is D. Respirations of 10 breaths per minute. Rationale: magnesium toxicity can occur as a result of magnesium sulfate therapy. Signs of magnesium sulfate toxicity relate to the central nervous system depressant effects of the medication and include respiratory depression, respiratory rate less than 12 breaths per minute, a loss of deep tendon reflexes, and a sudden drop in the fetal heart rate, maternal heart rate, and blood pressure. Therapeutic serum levels of magnesium are 4 to 7.5 milliequivalents per liter or 5 to 8 milligrams per deciliter. Proteinuria of 3+ is likely to be noted in a client with preeclampsia. Epidural analgesia is administered to a woman for pain relief after a cesarean birth. The nurse assigned to care for the woman ensures that which medication is readily available if respiratory depression occurs. A. Betamethasone. B. Morphine sulfate. C. Naloxone. D. Meperidine hydrochloride. The correct answer is C. Naloxone. Rationale: opioids are used for epidural analgesia. An adverse effect of epidural analgesia is a delayed respiratory depression. Naloxone is an opioid antagonist, which reverses the effects of opioids and is given for respiratory depression. Morphine sulfate and meperidine hydrochloride are opioid analgesics. Betamethasone is a corticosteroid that is administered to enhance fetal lung maturity. Rho-D immune globulin is prescribed for a woman after the delivery of a newborn infant, and the nurse provides information to the woman about the purpose of the medication. The nurse determines that the woman understands the purpose of the medication if the woman states that it will protect her next baby from which condition? A. Having Rh-positive blood. B. Developing a rubella infection. C. Developing physiological jaundice. D. Being affected by Rh incompatibility. The correct answer is D. Being affected by Rh incompatibility. Rationale: Rh incompatibility can occur when a Rh-negative mother becomes sensitized to the Rh antigen. Sensitization may develop when a Rh-negative woman becomes pregnant with a fetus that is Rh-positive. During pregnancy and at delivery, some of the baby's Rh-positive blood can enter the maternal circulation, thus causing the woman's immune system to form antibodies against the Rh-positive blood. The administration of Rho-D immune globulin prevents the woman from developing antibodies against Rh-positive blood by providing passive antibody protection against the Rh antigen. A woman with preeclampsia is receiving magnesium sulfate, which indicates to the nurse that the magnesium sulfate therapy is effective. A. Scotomas are present. B. Seizures do not occur. C. Ankle clonus is noted. D. The blood pressure decreases. The correct answer is B. Seizures do not occur. Rationale: for a client with preeclampsia, the goal of care is directed at preventing eclampsia seizures. Magnesium sulfate is an anticonvulsant rather than an antihypertensive agent. Although a decrease in blood pressure may be noted initially, this effect is usually transient. Scotomas are areas of complete or partial blindness. Visual disturbances, such as scotomas, often precede an eclamptic seizure. Ankle clonus indicates hyperreflexia and may precede the onset of eclampsia.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Methylergonavine is prescribed for a client with postpartum hemorrhage. Before administering the medication, the nurse should question administration of the medication if which condition is documented in the client's medical history. A. Hypotension. B. Hypothyroidism. C. Diabetes mellitus. D. Peripheral vascular disease. The correct answer is D. Peripheral vascular disease. Rationale: methylergonavine is an ergot alkaloid that is used to treat postpartum hemorrhage. Ergot alkaloids are avoided in clients with significant cardiovascular disease, peripheral vascular disease, hypertension, eclampsia, or preeclampsia because these conditions are worsened by the vasoconstrictive effects of the ergot alkaloids. The nursing instructor asks a nursing student to describe the procedure for administering erythromycin ointment to the eyes of a neonate. The instructor determines that the student needs to research this procedure further if the student makes which statement. A. I will flush the eyes after instilling the ointment. B. I will cleanse the neonate's eyes before instilling the ointment. C. The administration of the eye ointment is within 1 hour after delivery. D. I will instill the eye ointment into each of the neonate's conjunctival sacs. The correct answer is A. I will flush the eyes after instilling the ointment. Rationale: eye prophylaxis protects the neonate against Neisseria gonorrhoeae and Chlamydia trachomatis. The eyes are not flushed after the installation of the medication because the flush will wash away the administered medication. A 31-week preterm labor client dilated to 4 centimeters has been started on magnesium sulfate. Her contractions have stopped. If the client's labor can be inhibited for the next 48 hours, which medication does the nurse anticipate will be prescribed? A. Nalbuphine. B. Betamethasone. C. Misoprostol. D. Rho-D immune globulin. The correct answer is B. Betamethasone. Rationale: betamethasone, which is a glucocorticoid, is given to stimulate fetal lung maturation. It is used for clients in preterm labor between 28 and 32 weeks gestation if the labor can be inhibited for 48 hours. Nalbuphine is an opioid analgesic. Misoprostol is a prostaglandin that is given to ripen and soften the cervix and to stimulate uterine contractions. Rho-D immune globulin is given to Rh-negative clients to prevent sensitization. The nurse is caring for a client who is receiving oxytocin, pitocin, to induce labor. The nurse should discontinue the oxytocin infusion if which is noted on data collection of the client. A. Fatigue. B. Drowsiness. C. Uterine hyperstimulation. D. Early decelerations of the fetal heart rate. The correct answer is C. Uterine hyperstimulation. Rationale: oxytocin stimulates uterine contractions, and it is one of the common pharmacological methods used to induce labor. An adverse effect associated with the administration of the medication is the hyperstimulation of uterine contractions. Therefore, oxytocin infusion must be stopped when any signs of uterine hyperstimulation are present. Fatigue and drowsiness may be caused by the labor experience. Early decelerations of the fetal heart rate are a reassuring sign and do not indicate fetal distress. The client arrives at the emergency department after a burn injury that occurred in the basement at home, and an inhalation injury is suspected. Which should the nurse anticipate as being prescribed for the client? A. Oxygen via nasal cannula at 10 liters. B. Oxygen via nasal cannula at 15 liters. C. 100% oxygen via an aerosol mask. D. 100% oxygen via a tight-fitting, non-rebreather face mask. The correct answer is D. 100% oxygen via a tight-fitting, non-rebreather face mask. Rationale: if an inhalation injury is suspected, the administration of 100% oxygen via a tight-fitting, non-rebreather face mask is prescribed until the carboxyhemoglobin level falls below 15%. With inhalation injuries, the oropharynx is inspected for evidence of erythema, blisters, or ulcerations. The need for endotracheal intubation is also determined. The nurse assists in planning care for a child who sustained a burn injury. The nurse plans care based on which accurate statement? A. Scarring is not as severe in a child as in an adult. B. Children are at a lower risk of infection than adults because of their strong immune systems. C. Lower burn temperatures and shorter exposure to heat can cause a more severe burn in a child than an adult because a child's skin is thinner. D. Infants and children are at decreased risk for protein and calorie deficiency because they have smaller muscle mass and less body fat than adults. The correct answer is C. Lower burn temperatures and shorter exposure to heat can cause a more severe burn in a child than an adult because a child's skin is thinner. Rationale: lower burn temperatures and shorter exposure to heat can cause a more severe burn in a child than an adult because a child's skin is thinner. Scarring is more severe in a child. An immature immune system presents an increased risk of infection for infants and young children. Infants and children are at increased risk for protein and calorie deficiency because they have smaller muscle mass and less body fat than adults. The nurse is caring for an infant with a diagnosis of tetralogy of Fallot. The infant suddenly becomes cyanotic, and the oxygen saturation reading drops to 60%. Which interventions should the nurse perform? Select all that apply. A. Call a code blue. B. Notify the healthcare provider. C. Place the infant in a prone position. D. Prepare to administer morphine sulfate. E. Prepare to administer intravenous fluids. F. Prepare to administer 100% oxygen by face mask. The correct answers are B. Notify the healthcare provider. D. Prepare to administer morphine sulfate. E. Prepare to administer intravenous fluids, and F. Prepare to administer 100% oxygen by face mask. Rationale: the child who is cyanotic, with oxygen saturations dropping to 60%, is having a hypercyanotic episode. Hypercyanotic episodes often occur among infants with tetralogy of Fallot. If a hypercyanotic episode occurs, the infant is placed in a knee-chest position immediately. The HCP is notified. The knee-chest position improves systemic arterial oxygen saturation by decreasing venous return so that smaller amounts of highly saturated blood reach the heart. There is no reason to call a code blue unless respirations cease. Additional interventions include administering 100% oxygen by face mask, morphine sulfate, and intravenous fluids as prescribed. The nurse is caring for a client who has just been admitted to the nursing unit after receiving flame burns to the face and chest. The nurse notes a hoarse cough, and the client is expectorating sputum with black flecks. The client suddenly becomes restless, and his color is becoming dusky. The nurse should interpret this data as indicating which: A. The client is hypotensive. B. Pain is present from the burn injury. C. The burn has probably caused laryngeal edema, which has occluded the airway. D. The client is afraid, and is having a panic attack, as a result of the unfamiliar surroundings. The correct answer is C. The burn has probably caused laryngeal edema, which has occluded the airway. Rationale: the client exhibits several warning signs of an inhalation injury, a history of a flame burn to the face, hoarseness, cough, carbonaceous sputum, singed facial hair, facial edema, and color change. Additionally, one of the cardinal signs of hypoxia is restlessness. The nurse is assisting with caring for a client who is receiving intravenous fluids and who has sustained full-thickness burn injuries of the back and legs. The nurse understands that which would provide the most reliable indicator for determining the adequacy of the fluid resuscitation. A. Vital signs. B. Urine output. C. Mental status. D. Peripheral pulses. The correct answer is B. Urine output. Rationale: successful or adequate fluid resuscitation in the adult is signaled by stable vital signs, adequate urine output, palpable peripheral pulses, and a clear sensorium. The most reliable indicator for determining the adequacy of fluid resuscitation is the urine output. For an adult, the hourly urine volume should be 30 to 50 milliliter. A family of a spinal cord injured client rushes to the nursing station, saying that the client needs immediate help. On entering the room, the nurse notes that the client is diaphoretic, with a flushed face and neck, and complains of a severe headache. The pulse is 40 beats per minute, and the blood pressure is 230/100. The nurse acts quickly, knowing that the client is experiencing which: A. Spinal shock. B. Pulmonary embolism. C. Autonomic dysreflexia. D. Malignant hyperthermia. The correct answer is C. Autonomic dysreflexia. Rationale: the client with spinal cord injury above the level of T7 is at risk for autonomic dysreflexia. It is characterized by severe, throbbing headache, flushing of the face and neck, bradycardia, and sudden, severe hypertension. Other signs include nasal stuffiness, blurred vision, nausea, and sweating. It is a life-threatening syndrome, triggered by a noxious stimulus below the level of the injury. The nurse is performing a vaginal check of a pregnant client in labor. The nurse notes that the umbilical cord is protruding from the vagina. Which action should the nurse immediately perform? A. Administer oxygen to the client. B. Transport the client to the delivery room. C. Place an external fetal monitor on the client. D. Exert upward pressure against the presenting part with gloved fingers. The correct answer is D. Exert upward pressure against the presenting part with gloved fingers. Rationale: if the umbilical cord is protruding from the vagina, no attempt should be made to replace it, because to do so could traumatize it and further reduce blood flow. The nurse should place a gloved hand into the vagina toward the cervix and exert upward pressure against the presenting part to relieve compression of the cord. The nurse also should wrap the cord loosely in a sterile towel saturated with warm, sterile normal saline solution. Oxygen, 8 to 10 liter per minute by face mask, is administered to the mother to increase fetal oxygenation, and the client is prepared for immediate delivery. However, the immediate action is to relieve pressure on the cord. The client would already have an external fetal monitor in place. A client in the postpartum unit complains of sudden, sharp chest pain. The client is tachycardic, and the respiratory rate is increased, and the healthcare provider diagnoses a pulmonary embolism. Which interventions apply to the care of this client? Select all that apply. A. Administer oxygen. B. Monitor the blood pressure. C. Prepare to administer morphine sulfate. D. Prepare to start an intravenous line. F. Place the client on bed rest in a supine position. E. Prepare to administer warfarin sodium. The correct answers are A. Administer oxygen, B. Monitor the blood pressure, C. Prepare to administer morphine sulfate, and D. Prepare to start an intravenous line. Rationale: if pulmonary embolism is suspected, oxygen is administered to decrease hypoxia. The client also is kept on bed rest, with the head of the bed slightly elevated, not supine, to reduce dyspnea. Morphine sulfate may be prescribed for the client to reduce pain and apprehension. An IV line also will be required, and vital signs must be monitored. Heparin therapy is administered. A child is admitted to the burn unit, with partial and full-thickness burns, over 35% of the body. The nurse assisting in caring for the child develops the plan of care. Which nursing intervention is the priority? A. Inserting a Foley catheter. B. Inserting a nasogastric tube. C. Restricting intravenous fluids. D. Sedating the child with morphine sulfate. The correct answer is A. Inserting a Foley catheter. Rationale: a Foley catheter is inserted into the child's bladder so that urine output can be accurately measured hourly. Although pain medication may be required, the child should not be sedated. IV fluids are not restricted and are administered at a rate sufficient to maintain adequate tissue perfusion. A nasogastric tube may be required but would not be the priority intervention. A child is hospitalized with a diagnosis of lead poisoning. The nurse caring for the child should prepare to assist in administering which medication? A. Activated charcoal. B. Sodium bicarbonate. C. Syrup of ipecac. D. Dimercaprol. The correct answer is D. Dimercaprol. Rationale: dimercaprol is a chelating agent that is administered to remove lead from the circulating blood and from some tissues and organs for excretion in the urine. Sodium bicarbonate may be used in salicylate poisoning. Syrup of ipecac is used in the hospital setting, in poisonings, to induce vomiting. Activated charcoal is used to decrease absorption in certain poisoning situations. Note that dimercaprol is prepared with peanut oil, and hence should be avoided by clients with known or suspected peanut allergy. The emergency department nurse is caring for a child, brought to the emergency department, following the ingestion of approximately 1/2 bottle of acetylsalicylic acid. Which should the nurse anticipate as the likely initial treatment? A. Dialysis. B. The administration of vitamin K. C. The administration of activated charcoal. D. The administration of sodium bicarbonate. The correct answer is C. The administration of activated charcoal. Rationale: initial treatment of salicylate overdose includes administration of activated charcoal to decrease absorption of the aspirin. Intravenous fluids and inducing emesis may be prescribed to enhance excretion, but would not be the initial treatment. Dialysis is used in extreme cases if the child is unresponsive to therapy. Vitamin K is the antidote for warfarin overdose.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is assisting in preparing to administer acetylcysteine to a client with an overdose of acetaminophen. How should the nurse administer the medication? A. Administer the medication subcutaneously in the deltoid muscle. B. Administer the medication by the intramuscular route in the gluteal muscle. C. Administer the medication by the intramuscular route, mixed in 10 ml of normal saline. D. Mix the medication in a flavored iced drink and allow the client to drink the medication through a straw. The correct answer is D. Mix the medication in a flavored iced drink and allow the client to drink the medication through a straw. Rationale: because acetylcysteine has a pervasive odor of rotten eggs, it must be disguised in a flavored iced drink. It is consumed preferably through a straw to minimize contact with the mouth. It is not administered by the intramuscular or subcutaneous route. A client who sustained an inhalation injury arrives in the emergency department. On data collection, the nurse notes that the client is very confused and combative. The nurse determines that the client is experiencing which? A. Fear. B. Pain. C. Hypoxia. D. Anxiety. The correct answer is C. Hypoxia. Rationale: after a burn injury, clients are normally alert. If a client becomes confused or combative, hypoxia may be the cause. Hypoxia occurs after inhalation injury and may occur after an electrical injury. A client is brought to the emergency department following a smoke inhalation injury. The initial nursing action is to prepare the client to receive which treatment? A. Pain medication. B. Endotracheal intubation. C. Oxygen via nasal cannula. D. 100% humidified oxygen by face mask. The correct answer is D. 100% humidified oxygen by face mask. Rationale: if the client sustains a smoke inhalation injury, the client is treated immediately with 100% humidified oxygen delivered by face mask. Oxygen via nasal cannula will not provide adequate oxygenation. Endotracheal intubation is needed if the client exhibits respiratory stridor, which then indicates airway obstruction. Pain management is necessary but is not the initial concern. An emergency department nurse is caring for a client who sustained a burn injury to the anterior arms and anterior chest area. The client sustained the burn from a home fire that occurred in the basement. Which data would indicate that the client sustained a respiratory injury as a result of the burn? A. Fear and anxiety. B. Complaints of pain. C. Clear breath sounds. D. Use of accessory muscles for breathing. The correct answer is D. Use of accessory muscles for breathing. Rationale: clinical indicators in a burn client that would indicate respiratory injury include the presence of facial burns, the presence of soot around the mouth or nose, and singed nasal hairs. Signs of respiratory difficulty include changes in respiratory rate and the use of accessory muscles for breathing. Although anxiety may be a sign of hypoxemia, anxiety along with bradycardia, dysrhythmias, and lethargy would most likely indicate a concern related to a respiratory injury. Abnormal breath sounds and abnormal arterial blood gas values would also be noted. Pain is not specifically related to a respiratory injury. A postpartum client has lost 700 milliliter of blood. The vital signs indicate hypovolemia, and the uterus remains atonic in spite of treatment. The nurse assisting in caring for the client understands what is necessary in this situation and prepares the client for which treatment? A. Fundal massage. B. A blood transfusion. C. Emergency surgery. D. An infusion of oxytocin. The correct answer is C. Emergency surgery. Rationale: options A, B, and D identify interventions to reverse uterine atony. When uterine atony cannot be reversed, surgery is required. The nurse assists in administering first aid to a client who has been bitten by a snake on the right leg. The nurse should take which action? A. Apply a tourniquet. B. Apply ice to the site of the bite. C. Elevate the leg above the level of the heart. D. Ensure that the victim is lying down and remove restrictive items. The correct answer is D. Ensure that the victim is lying down and remove restrictive items. Rationale: initial first aid at the site of a snakebite includes having the victim lie down, removing constrictive items such as clothing or rings, providing warmth, cleansing the wound, covering the wound with a light sterile dressing, and immobilizing the injured body part below the level of the heart. Ice or a tourniquet is not applied during the acute stage. The nurse receives a telephone call from a neighbor who states that her child was found sitting on the floor near the kitchen sink, playing with several bottles of cleaning fluids. The bottles of cleaning fluid were opened and spilled on the child and the floor, and the mother suspects that the child may have consumed some of the cleaning fluid. Which action should the nurse tell the mother to do immediately? A. Call the healthcare provider. B. Call the poison control center. C. Call the pharmacy to purchase syrup of ipecac for administration. D. Call an ambulance to bring the child to the emergency department. The correct answer is B. Call the poison control center. Rationale: the poison control center should be called if an unknown toxic agent has been ingested, or if it is necessary to identify an antidote for a known toxic agent. Syrup of ipecac is used to induce vomiting in a conscious client, but vomiting is not induced after ingestion of caustic substances or petroleum distillates. In addition, it is inadvisable for parents to administer syrup of ipecac. This action, if warranted, should be done under medical supervision. Calling an ambulance or calling the health care provider will delay necessary life-saving measures. The nurse discusses emergency nursing measures that are implemented at the site of an injury with a nursing student. Which initial action does the nurse tell the student to perform in the event of carbon monoxide poisoning? A. Carry the client to fresh air. B. Wrap the client in blankets. C. Keep the client as quiet as possible. D. Initiate cardiopulmonary resuscitation. The correct answer is A. Carry the client to fresh air. Rationale: whenever a victim inhales a poison, the victim is carried immediately to fresh air. Any tight clothing is then loosened and CPR is initiated if necessary. Oxygen is administered as soon as possible. Chilling is prevented and the victim is wrapped in blankets and kept as quiet as possible. A client who sustained a severe burn injury is brought to the emergency department. The nurse prepares to implement which immediate action? A. Insert an endotracheal tube. B. Assess neurological function. C. Administer 100% humidified oxygen. D. Cover the client with a warm blanket. The correct answer is C. Administer 100% humidified oxygen. Rationale: when a victim who sustains a burn injury arrives at the emergency department, a patent airway is established and breathing is assessed immediately. The client is also immediately given 100% humidified oxygen. If the victim has severe respiratory distress or airway edema, then an endotracheal tube is inserted for mechanical ventilation. Clean sheets are placed over the client and the client's body temperature is maintained. The client's neurological status is assessed, however, this is not the immediate action. The client with myasthenia gravis is receiving pyridostigmine. The nurse monitors for signs and symptoms of cholinergic crisis caused by overdose of the medication. The nurse checks the medication supply to ensure that which medication is available for administration if a cholinergic crisis occurs. A. Vitamin K. B. Acetylcysteine. C. Atropine sulfate. D. Protamine sulfate. The correct answer is C. Atropine sulfate. Rationale: the antidote for cholinergic crisis is atropine sulfate. Acetylcysteine is the antidote for acetaminophen. Vitamin K is the antidote for warfarin, and protamine sulfate is the antidote for heparin. The nurse is caring for a client receiving morphine sulfate intravenously for pain. Because morphine sulfate has been prescribed for this client, which nursing action should be included in the plan of care? A. Encourage fluid intake. B. Monitor the client's temperature. C. Maintain the client in a supine position. D. Encourage the client to cough and deep breathe. The correct answer is D. Encourage the client to cough and deep breathe. Rationale: morphine sulfate suppresses the cough reflex. Clients need to be encouraged to cough and deep breathe to prevent pneumonia. The remaining options are not specifically associated with this medication. Meperidine hydrochloride is prescribed for the client with pain. Which should the nurse monitor as a side effect of this medication? A. Diarrhea. B. Bradycardia. C. Hypertension. D. Urinary retention. The correct answer is D. Urinary retention. Rationale: meperidine hydrochloride is an opioid analgesic. Side effects of this medication include respiratory depression, orthostatic hypotension, tachycardia, drowsiness and mental clouding, constipation, and urinary retention. Mannitol is being administered to a client with increased intracranial pressure following a head injury. The nurse assisting in caring for the client knows that, which indicates the therapeutic action of this medication. A. Prevents the filtration of sodium and water through the kidneys. B. Prevents the filtration of sodium and potassium through the kidneys. C. Decreases water loss by promoting the reabsorption of sodium and water in the loop of Henle. D. Induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. The correct answer is D. Induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. Rationale: mannitol is an osmotic diuretic that induces diuresis by raising the osmotic pressure of glomerular filtrate, thereby inhibiting tubular reabsorption of water and solutes. It is used to reduce intracranial pressure in the client with head trauma. A healthcare provider initiates carbidopa/levodopa therapy for the client with Parkinson's disease. A few days after the client starts the medication, the client complains of nausea and vomiting. What should the nurse tell the client regarding how to avoid side effects when taking carbidopa/levodopa? A. Taking an antiemetic is the best measure to prevent the nausea. B. Taking the medication with food will help to prevent the nausea. C. This is an expected side effect of the medication and will decrease over time. D. The nausea and vomiting will decrease when the dose of levodopa is stabilized. The correct answer is B. Taking the medication with food will help to prevent the nausea. Rationale: if carbidopa/levodopa is causing nausea and vomiting, the nurse would tell the client that taking the medication with food will prevent the nausea. Additionally, the client should be instructed not to take the medication with a high-protein meal, because the high protein will affect absorption. Antiemetics from the phenothiazine class should not be used because they block the therapeutic action of dopamine. Neuroleptic malignant syndrome is suspected in a client who is taking chlorpromazine. Which medication should the nurse prepare in anticipation of the prescription to treat this adverse effect related to the use of chlorpromazine? A. Protamine sulfate. B. Bromocriptine. C. Phytonadione. D. Enalapril maleate. The correct answer is B. Bromocriptine. Rationale: bromocriptine is an anti-Parkinsonian prolactin inhibitor used in the treatment of neuroleptic malignant syndrome. Protamine sulfate is the antidote for heparin overdose. Vitamin K is the antidote for warfarin overdose. Enalapril maleate is an antihypertensive used in the treatment of hypertension.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is placed on chloral hydrate for short-term treatment. Which nursing action indicates an understanding of the major side effect of this medication? A. Monitoring neurological signs every 2 hours. B. Monitoring the blood pressure every 4 hours. C. Instructing the client to call for ambulation assistance. D. Lowering the bed and clearing a path to the bathroom at bedtime. The correct answer is C. Instructing the client to call for ambulation assistance. Rationale: chloral hydrate causes sedation and impairment of motor coordination, therefore, safety measures need to be implemented. The client is instructed to call for assistance with ambulation. Options A and B are not specifically associated with the use of this medication. Although option D is an appropriate nursing intervention, it is most important to instruct the client to call for assistance with ambulation. A client with Parkinson's disease has been prescribed benztropine. The nurse monitors for which gastrointestinal side effect of this medication. A. Diarrhea. B. Dry mouth. C. Increased appetite. D. Hyperactive bowel sounds. The correct answer is B. Dry mouth. Rationale: common GI side effects of benztropine therapy include constipation and dry mouth. Other GI side effects include nausea and ileus. These effects are the result of the anticholinergic properties of the medication. A hospitalized client is having the dosage of clonazepam adjusted. The nurse should plan to implement which action? A. Weighing the client daily. B. Observing for ecchymosis. C. Instituting seizure precautions. D. Monitoring blood glucose levels. The correct answer is C. Instituting seizure precautions. Rationale: clonazepam is a benzodiazepine used as an anticonvulsant. During initial therapy and during periods of dosage adjustment, the nurse should initiate seizure precautions for the client. The nurse has given medication instructions to a client beginning anticonvulsant therapy with carbamazepine. The nurse determines that the client understands the use of the medication if the client knows to perform which activity. A. Use sunscreen when outside. B. Drive as long as it is not at night. C. Discontinue the medication if fever or sore throat occurs. D. Keep tissues handy because of excess salivation that may occur. The correct answer is A. Use sunscreen when outside. Rationale: carbamazepine acts by depressing synaptic transmission in the central nervous system. Because of this, the client should avoid driving or doing other activities that require mental alertness until the effect on the client is known. The client should use protective clothing and sunscreen to avoid photosensitivity reactions. The medication may cause dry mouth and not excessive salivation. The medication should not be abruptly discontinued because it could cause return of seizures or status epilepticus. Fever and sore throat should be reported to the health care provider. A client with vascular headaches is taking ergotamine. Which client complaint should the nurse monitor? A. Constipation. B. Hypotension. C. Dependent edema. D. Cool, numb fingers and toes. The correct answer is D. Cool, numb fingers and toes. Rationale: ergotamine produces vasoconstriction, which suppresses vascular headaches when given at a therapeutic dose range. The nurse monitors for hypertension, cool, numb fingers and toes, muscle pain, and nausea and vomiting. The nurse is caring for a client with myasthenia gravis, who has received edrophonium intravenously to test for myasthenic crisis. The client asks the nurse how long the improvement in muscle strength will last. The nurse's response is based on the understanding that the duration is usually how many minutes? A. 5 minutes. B. 15 minutes. C. 30 minutes. D. 60 minutes. The correct answer is C. 30 minutes. Rationale: edrophonium may be given to test for myasthenic crisis. If the client is in myasthenic crisis, muscle strength improves after administration of the medication and lasts for about 30 minutes. A client with narcolepsy has been prescribed a central nervous stimulant. The client complains to the nurse that he cannot sleep well anymore at night and does not want to take the medication any longer. Before making any specific comment, the nurse plans to investigate whether the client takes the medication, at which time schedule. A. After dinner each day. B. Just before going to bed. C. 2 hours before bedtime. D. At least 6 hours before bedtime. The correct answer is D. At least 6 hours before bedtime. Rationale: a central nervous system stimulant acts by releasing norepinephrine from nerve endings. The client should take the medication at least 6 hours before going to bed at night to prevent disturbances with sleep. Taking the medication at the time frames indicated in options A, B, and C will prevent the client from sleeping because of the stimulant properties of the medication. A client is taking trihexyphenidyl for the treatment of Parkinson's disease. The nurse should monitor for which side effect of this medication. A. Diarrhea. B. Urinary retention. C. Urinary incontinence. D. Excessive perspiration. The correct answer is B. Urinary retention. Rationale: trihexyphenidyl is an anticholinergic medication. Because of this, it can cause urinary hesitancy and retention, constipation, dry mouth, and decreased sweating as side effects. A client receiving therapy with carbidopa/levodopa is upset and tells the nurse that his urine has turned a darker color since he began to take the medication. The client wants to discontinue its use. In formulating a response to the client's concerns, how does the nurse interpret this development? A. Indicative of developing toxicity. B. A harmless side effect of the medication. C. A result of taking the medication with milk. D. A sign of interaction with another medication. The correct answer is B. A harmless side effect of the medication. Rationale: with carbidopa/levodopa therapy, a darkening of the urine or sweat may occur. The client should be reassured that this is a harmless effect of the medication and its use should be continued. A client began taking amantadine approximately 2 weeks ago. Which decreased symptom should the nurse expect to see if the medication is having a therapeutic effect? A. Decreased voiding. B. Decreased blood pressure. C. Decreased rigidity and akinesia. D. Decreased white blood cell count. The correct answer is C. Decreased rigidity and akinesia. Rationale: amantadine is an anti-Parkinson agent that potentiates the action of dopamine in the central nervous system. The expected effect of therapy is a decrease in akinesia and rigidity. Leukopenia, urinary retention, and hypotension are all adverse effects of the medication. A client is receiving anticonvulsant therapy with phenytoin. The nurse plans to monitor the results of which laboratory test closely? A. Serum sodium. B. Serum potassium. C. Blood urea nitrogen. D. Complete blood cell count. The correct answer is D. Complete blood cell count. Rationale: the nurse would monitor the client's complete blood cell counts because hematological side effects of this therapy include aplastic anemia, agranulocytosis, leukopenia, and thrombocytopenia. Other values that warrant monitoring include serum calcium levels and the results of urinalysis and hepatic and thyroid function tests. The nurse is caring for a hospitalized child with a history of seizures who is receiving oral phenytoin sodium. Which should be included in the plan of care for this child? A. Monitoring intake and output. B. Providing oral hygiene, especially care of the gums. C. Administering medications 1 hour before food intake. D. Checking the heart rate before administering the phenytoin. The correct answer is B. Providing oral hygiene, especially care of the gums. Rationale: phenytoin sodium causes gum bleeding and hypertrophy, therefore, oral hygiene is important. Soft toothbrushes and gum massage should be instituted to reduce the risk of complications and prevent further trauma. Options A and D are incorrect because the intake and output, as well as heart rate, are not affected by this medication. Option C is incorrect because directions for administration of this medication include administering with food to minimize gastrointestinal upset. A client is admitted to the hospital because of complaints of vomiting and abdominal pain. During data collection, the client tells the nurse that he is taking entacapone. Based on this finding, the nurse elicits information from the client regarding the presence of which condition? A. Hypertension. B. Hyperlipidemia. C. Parkinson's disease. D. Peripheral vascular disease. The correct answer is C. Parkinson's disease. Rationale: entacapone is an anti-Parkinsonian agent used in conjunction with levodopa to improve the quality of life in clients with Parkinson's disease. It is not used to treat cardiovascular disorders. Carbidopa-levodopa is prescribed for a client with Parkinson's disease, and the nurse monitors the client for adverse effects of the medication. Which sign/symptom indicates that the client is experiencing an adverse effect? A. Pruritus. B. Tachycardia. C. Hypertension. D. Impaired voluntary movements. The correct answer is D. Impaired voluntary movements. Rationale: dyskinesia and impaired voluntary movement may occur with high levodopa dosages. Nausea, anorexia, dizziness, orthostatic hypotension, bradycardia, and akinesia are frequent side effects of the medication. Which early responses indicate to the nurse that the patient is experiencing hypoxia? Select all that apply. A. Increased heart rate. B. Tachypnea. C. Restlessness. D. Bradypnea. E. Irritability. The correct answers are A. Increased heart rate, B. Tachypnea, C. Restlessness, and E. Irritability. Rationale: more than 100 beats per minute is an early response to hypoxia. Restlessness occurs with hypoxia because of a decrease in oxygen to the brain. An increase in respirations more than 20 breaths per minute, not a decrease in respirations less than 12 breaths per minute, occurs as the body attempts to deliver more oxygen to body cells. Irritability occurs with hypoxia because of a decrease in oxygen to the brain.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse is assessing several patients who had surgery the previous day. Which sudden patient response should the nurse identify as a potential life-threatening event? A. Slightly elevated temperature. B. Separation of wound edges. C. Edema of the legs. D. Chest pain. The correct answer is D. Chest pain. Rationale: an acute onset of chest pain within 24 hours of surgery may indicate myocardial infarction in response to the stress of surgery. Also, it can be caused by a pulmonary embolus. Both of these complications are life-threatening. A slight elevation of body temperature is expected after surgery because of the body's response to the stress of surgery. Separation of the wound edges is not life-threatening. Dependent edema indicates problems such as a fluid and electrolyte imbalance, impaired kidney function, or decreased cardiac output. All are serious but generally manageable. A nurse must administer a sedative to a patient before surgery. Which should the nurse do first? A. Verify that the preoperative checklist is completed. B. Check that the surgical consent is signed. C. Ensure an intravenous line is in place. D. Assess vital signs. The correct answer is B. Check that the surgical consent is signed. Rationale: the consent for surgery must be signed before preoperative medications are administered because they depress the central nervous system, impairing problem-solving and decision-making. Although checking the preoperative checklist is done, it is not the priority. Although assessing vital signs is done, it is not the priority. Ensuring placement of an IV line is not the priority. A primary health care provider orders a clear liquid diet for a patient who had abdominal surgery 3 days ago. Which does the nurse conclude is the reason why a clear liquid diet was ordered for this patient? A. Relieves abdominal distension. B. Stimulates digestive enzymes. C. Prevents postoperative ileus. D. Digests easily. The correct answer is D. Digests easily. Rationale: the molecules in clear liquids are less complex and easier to ingest, tolerate, and digest than those in a full liquid diet or food. A clear liquid diet will not prevent postoperative ileus. A clear liquid diet will minimally stimulate digestive enzymes. A full liquid diet or food will more likely stimulate gastric enzymes. A nurse causes harm to a hospitalized patient because of improper use of medical equipment. What is this tort specifically called? A. Battery. B. Assault. C. Slander. D. Malpractice. The correct answer is D. Malpractice. Rationale: malpractice is misconduct, an act of commission or omission performed in professional practice that results in harm to another. With malpractice, the nurse and patient have a professional nurse-patient relationship. An older adult asks the nurse, "I want to make sure I get enough vitamin A to keep my eyes healthy. Which fruits can I eat?" Which fruits should the nurse explain are excellent sources of vitamin A? Select all that apply. A. Cantaloupe. B. Apricots. C. Peaches. D. Raisins. E. Prunes. The correct answers are A. Cantaloupe, B. Apricots, C. Peaches, and E. Prunes. Rationale: cantaloupe, apricots, peaches, and prunes are excellent sources of vitamin A. Raisins are not high in vitamin A. A patient has a diagnosis of osteoporosis. Which foods should the nurse encourage this patient to eat? Select all that apply. A. Rice. B. Milk. C. Yogurt. D. Sardines. E. Almonds. F. Tomatoes. The correct answers are B. Milk, C. Yogurt, D. Sardines, and E. Almonds. Rationale: 8 ounces of 1% low-fat milk contain approximately 290 milligrams of calcium. 8 ounces of plain non-fat yogurt contains approximately 452 milligrams of calcium. 3 ounces of sardines contain approximately 371 milligrams of calcium. 1 ounce of almonds contains approximately 75 milligrams of calcium. Tomatoes and rice are not high in calcium. A patient is asked to participate in a medical research study. Which document should the nurse explain to the patient because it protects the patient's rights? A. Code of Ethics. B. Informed Consent. C. Nurse Practice Act. D. Constitution of the United States. The correct answer is B. Informed Consent. Rationale: informed consent is an agreement by a person to accept a course of treatment or a procedure after receiving complete information necessary to make a knowledgeable decision. Nurse Practice Acts define the scope of nursing practice. They are unrelated to participation in research studies. For which most serious complication of intubation, associated with the administration of general anesthesia, should the nurse assess a postoperative patient? A. Stomatitis. B. Atelectasis. C. Sore throat. D. Laryngeal spasm. The correct answer is D. Laryngeal spasm. Rationale: laryngeal spasm is a potentially life-threatening complication because it prevents the exchange of gases between the lungs and the atmosphere. Laryngeal spasm can result from irritation caused by the presence of the intubation tube in the space between the vocal cords during surgery. Which element of ethical practice is associated with fair policies and procedures guiding allocation of organs for transplantation? A. Justice. B. Fidelity. C. Veracity. D. Non-maleficence. The correct answer is A. Justice. Rationale: justice refers to fairness and that all patients should be treated equally, impartially, and without prejudice, regardless of individual factors. Fidelity refers to making only promises or commitments that can be kept. Veracity refers to being truthful, which is essential to a trusting nurse-patient relationship. Non-maleficence refers to preventing harm, avoiding actions that can cause harm, or removing a patient from harm. A primary health care provider orders a 2-gram sodium diet for a patient. Which fluids should the nurse teach are high in sodium? Select all that apply. A. Cocoa. B. Seltzer. C. Lemonade. D. Low-fat milk. E. Tomato juice. The correct answers are A. Cocoa, D. Low-fat milk, and E. Tomato juice. Rationale: cocoa powder, containing non-fat dry milk, contains approximately 173 milligrams of sodium when mixed with 6 ounces of water. 1 cup of low-fat milk contains approximately 103 milligrams of sodium. 1 cup of tomato juice contains approximately 877 milligrams of sodium. They all should be avoided on a 2-gram sodium diet. Seltzer contains no sodium. 12 fluid ounces of lemonade contains approximately 12 milligrams of sodium. A nurse witnesses an accident and assists the victim, who has a life-threatening injury. Which should the nurse do to meet an important standard of care when acting as a good Samaritan at the scene of an accident? A. Seek consent from the injured party before rendering assistance. B. Implement every critical care intervention necessary to sustain life. C. Stay at the scene until another qualified person takes over responsibility. D. Insist on helping because a nurse is the best qualified person to provide care. The correct answer is C. Stay at the scene until another qualified person takes over responsibility. Rationale: when a nurse renders emergency care, the nurse has an ethical responsibility not to abandon the injured person. The nurse should not leave the scene until the injured person leaves or another qualified person assumes responsibility. Depending on the injured person's physical and emotional status, the person may or may not be able to consent to care. The nurse should not attempt interventions that are beyond the scope of nursing practice. When a nurse is administering a medication to a confused patient, the patient says, "This pill looks different from the one I had before." What should the nurse do? A. Ask what the other pill looked like. B. Explain the purpose of the medication. C. Check the original medication prescription. D. Encourage the patient to take the medication. The correct answer is C. Check the original medication prescription. Rationale: answer C is the safest intervention because it goes to the original source of the prescription. Answer B ignores the patient's concern. Answer A is unsafe because the patient is confused and the information obtained may be inaccurate. Answer D ignores the patient's statement and is unsafe without first obtaining additional information. A patient is admitted with lower gastrointestinal tract bleeding. Which characteristic of the stool supports this diagnosis? A. Tarry stool. B. Orange stool. C. Green mucoid stool. D. Bright red tinged stool. The correct answer is D. Bright red tinged stool. Rationale: bright red tinged stools are the cardinal sign of lower gastrointestinal bleeding. When bleeding occurs close to the anus, enzymes have not digested the blood, so the blood has not turned black. Tarry stools indicate upper gastrointestinal bleeding. Orange stools and green mucoid stools indicate the presence of infection. An anxious patient repeatedly uses the call bell to get the nurse to come to the room. Finally, the nurse says to the patient, "If you keep ringing, there will come a time I won't answer your bell." Which legal term is related to this statement? A. Slander. B. Battery. C. Assault. D. Libel. The correct answer is C. Assault. Rationale: this is an example of assault. Assault is a verbal attack or unlawful threat causing a fear of harm. No actual contact is necessary for a threat to be an assault. Slander is a false spoken statement resulting in damage to a person's character or reputation. Battery is the unlawful touching of a person's body without consent. Libel is a false printed statement resulting in damage to a person's character or reputation. For which primary reason is a nurse expert called to testify in a lawsuit regarding professional nursing malpractice? A. To strengthen the defense. B. Support the prosecution. C. To present standards of nursing care as they apply to the facts in the case. D. Make judgments associated with laws governing the practice of nursing. The correct answer is C. To present standards of nursing care as they apply to the facts in the case. Rationale: the American Nurses Association Standards of Clinical Nursing Practice are authoritative statements by which the National Organization for Nursing describes the responsibilities for which nurses are accountable. An expert nurse is capable of explaining these standards as they apply to the situation under litigation. These professional standards are criteria that help a judge or jury determine if a nurse committed malpractice or negligence.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse must administer a medication. Which should the nurse do first? A. Verify the prescription for accuracy. B. Check the patient's identification armband. C. Ensure the medication is in the medication cart. D. Determine the appropriateness of the prescribed medication. The correct answer is A. Verify the prescription for accuracy. Rationale: the administration of medications is a dependent function of the nurse. The primary healthcare provider's prescription should be verified for accuracy. The prescription must include the name of the patient, the name of the drug, the size of the dose, the route of administration, the number of times per day to be administered, and any related parameters. The other actions may be done, but are not the first step, when preparing to administer a medication to a patient. A patient sustains soft tissue injuries from a motor vehicle collision. Which intervention is helpful in limiting the stress of both edema and bleeding into tissue? A. Applying a cold compress. B. Exerting direct pressure. C. Performing effleurage. D. Providing massage. The correct answer is A. Applying a cold compress. Rationale: cold lowers the temperature of skin and underlying tissue, which causes vasoconstriction, reducing blood flow to the area. This controls bleeding and slows the passage of fluid from the intravascular to the interstitial compartment, which limits edema. Which organization is responsible for ensuring that nurses are minimally qualified to practice nursing? A. State Boards of Nursing. B. American Nurses Association. C. Sigma Theta Tau International. D. Constituent Leagues of the National League for Nursing. The correct answer is A. State Boards of Nursing. Rationale: the National Council of State Boards of Nursing is responsible for the NCLEX examinations. However, the licensing authority in the jurisdiction in which the graduate takes the examination verifies the acceptable score on the examination. A homeless client comes to the emergency department complaining of severe pain in the toes of both feet. On assessment, it is found that all of the toes are black in color and that amputation is necessary. The client refuses the surgery and insists on returning to street living. Which describes the next appropriate action to take? A. Obtain a court order for the surgical procedure. B. Restrain the client and transport to the operating room for surgery. C. Call the police to identify the client and to arrest the client until permission for surgery is granted. D. Discuss the surgical procedure and its purpose with the client and encourage the client to talk about concerns and feelings. The correct answer is D. Discuss the surgical procedure and its purpose with the client and encourage the client to talk about concerns and feelings. Rationale: in general, there are only two situations in which the informed consent of an adult client is not needed. One is when an emergency is present and delaying treatment for the purpose of obtaining informed consent would result in injury or death to the client. The second is when the client waives the right to give informed consent. In this situation, informed consent is necessary if the client is mentally competent. Restraining the client and having the client arrested violates client rights. The next appropriate action to take is to explore and determine the reasons why the client is refusing surgery and to allow the client an opportunity to express any concerns. A patient is scheduled to have surgery, and informed consent is to be obtained. Place the following steps in the order in which they should be performed. A. The patient is willing to sign the consent voluntarily. B. The patient signs the consent in the presence of the nurse. C. The nurse determines that the patient is alert and competent to give consent. D. The primary healthcare provider informs the patient of the risks and benefits of the procedure. The correct order is D. The primary healthcare provider informs the patient of the risks and benefits of the procedure. C. The nurse determines that the patient is alert and competent to give consent. A. The patient is willing to sign the consent voluntarily, and B. The patient signs the consent in the presence of the nurse. Rationale: it is the responsibility of the primary HCP to include all the information necessary to make a knowledgeable decision. The patient must be alert, competent, and in touch with reality. Confused, sedated, unconscious, or minor patients may not give consent. Patients must give their consent voluntarily and without coercion. The healthcare provider, witnessing the signing of the consent, must ensure that the signature is genuine. Which should the nurse do when the vent of a patient's double-lumen nasogastric tube for decompression becomes obstructed? A. Instill 10 ml of air into the vent lumen. B. Place the patient in the high Fowler position. C. Position the vent below the level of the stomach. D. Withdraw 30 ml of gastric contents from the drainage lumen. The correct answer is A. Instill 10 ml of air into the vent lumen. Rationale: the only way to re-establish patency of the air vent lumen of a double-lumen nasogastric tube is to instill air into the lumen. The injected air will push the secretions blocking the lumen back into the stomach, where the fluid can be removed by the drainage lumen. Keeping the end of the air vent lumen higher than the stomach prevents reflux of gastric contents into the air vent lumen. When a nurse attempts to administer a medication to a patient, the patient refuses to take the medication because it causes diarrhea. The nurse provides teaching about the medication, but the patient continues adamantly to refuse the medication. Which should the nurse do first? A. Document the patient's refusal to take the medication. B. Discuss with a family member the need for the patient to take the medication. C. Explain again to the patient the consequences of refusing to take the medication. D. Notify the primary healthcare provider of the patient's refusal to take the medication. The correct answer is A. Document the patient's refusal to take the medication. Rationale: withholding the medication and documenting the patient's refusal are the appropriate interventions. Patients have a right to refuse care. Discussing the situation with a family member without the patient's consent is a violation of confidentiality. The patient has been taught about the medication and adamantly refuses the medication. Further teaching at this time may be viewed by the patient as badgering. Notifying the primary healthcare provider eventually should be done, but it is not the priority at this time. Identify the actions that are examples of slander. Select all that apply. A. A volunteer telling another volunteer a patient's age. B. Nurse explaining to a patient that another nurse is incompetent. C. Personal care assistant sharing information about a patient with another patient. D. Unit manager documenting a nurse's medication error in a performance appraisal. E. Housekeeper who is angry at a nurse, falsely telling another staff member that the nurse is a thief. The correct answers are B. Nurse explaining to a patient that another nurse is incompetent, and E. Housekeeper who is angry at a nurse, falsely telling another staff member that the nurse is a thief. Rationale: answer B is an example of slander. Slander is a false spoken statement resulting in damage to a person's character or reputation. Answer E is a malicious false statement that may damage the nurse's reputation. Answer A and C is a violation of the patient's right to confidentiality, not slander. Answer D is not slander because it is a written, not a spoken statement, and it documents the truth, not false information. A patient develops diarrhea after receiving several intermittent tube feedings. Which should the nurse consider is the cause of the diarrhea? A. A high osmolarity of the feeding. B. An inadequate volume of the feeding. C. Failure to test for a residual before the feeding. D. Lying in the high Fowler position during the feeding. The correct answer is A. A high osmolarity of the feeding. Rationale: a tube feeding formula usually is hypertonic, which exerts an osmotic force that pulls fluid into the stomach and intestine, resulting in intestinal cramping and diarrhea. An inadequate volume of the feeding may result in fluid volume deficit and malnutrition, not diarrhea. Failure to test for a residual before the feeding may result in vomiting, not diarrhea. When preparing to administer a medication, the nurse identifies that the dose is larger than the standard dose recommended by the manufacturer. Which should the nurse do? A. Inform the supervisor. B. Give the drug as prescribed. C. Give the average dose of the medication. D. Discuss the prescription with the primary healthcare provider. The correct answer is D. Discuss the prescription with the primary healthcare provider. Rationale: nurses have a professional responsibility to know or investigate the standard dose for medications being administered. Nurses are also responsible for their own actions, regardless of whether there is a written prescription. The nurse has a responsibility to question and/or refuse to administer a prescription that appears unreasonable. Giving the drug as prescribed may be unsafe for the patient and may result in malpractice. Changing a medication prescription is not within the scope of nursing practice. A student nurse is about to graduate from an accredited nursing program. Which does the student nurse understand are actions unrelated to a state Nurse Practice Act? Select all that apply. A. Setting guidelines for nurses' salaries in the state. B. Establishing reciprocity for licensure between states. C. Determining minimum requirements to be licensed as a nurse. D. Maintaining a list of nurses who can legally practice in the state. E. Providing legal counsel for a nurse who is being sued for malpractice. The correct answers are A. Setting guidelines for nurses' salaries in the state, D. Maintaining a list of nurses who can legally practice in the state, and E. Providing legal counsel for a nurse who is being sued for malpractice. Rationale: the salary of nurses is determined through negotiations between nurses and their employers. A list of nurses who can legally practice in the state usually are delegated to another official body, such as a state board of nursing or state education department. State Nurse Practice Acts do not provide legal counsel for a nurse who is sued for malpractice. A state's Nurse Practice Act determines the criteria for reciprocity for licensure. A state's Nurse Practice Act stipulates minimum requirements required for a person to be licensed as a nurse. A nurse is providing dietary teaching for a patient who is a pure vegan. Which food combinations that are substitutes for a complete protein should the nurse include in the dietary teaching? Select all that apply. A. Pasta and peas. B. Yogurt and fruit. C. Bread and cheese. D. Legumes and rice. E. Peanut butter and jelly. The correct answers are A. Pasta and peas and D. Legumes and rice. Rationale: pasta is made from grains and peas are legumes, which together provide amino acids that make a complete protein. Complete proteins supply all 8 essential amino acids. Rice and legumes lack different amino acids. When these foods are combined, they substitute for a complete protein. A nurse administers an incorrect dose of a medication to a patient. Which is the primary purpose of documenting this event in an incident report? A. Record the event for future litigation. B. Provide a basis for designing new policies. C. Prevent similar situations from happening again. D. Ensure accountability for the cause of the accident. The correct answer is C. Prevent similar situations from happening again. Rationale: risk management committees use statistical data about accidents and incidents to identify patterns of risk and prevent future accidents and incidents. Providing a basis for designing new policies is not the primary reason for incident reports. Although documentation of an incident may be used in a court of law, it is not the primary reason for an incident report. Although nurses are always accountable for their actions, accountability for the cause of an incident is the role of the courts. A nurse is administering medication to an older adult. A decrease in which of the following increases the risk of drug toxicity in this patient? A. Serum calcium level. B. Red blood cell count. C. Glomerular filtration. D. Frequency of urination. The correct answer is C. Glomerular filtration. Rationale: the glomerular filtration rate is reduced by as much as 46% at 90 years of age. In addition, decreased cardiac output can reduce the amount of blood flow to the kidneys by as much as 50%. When the glomerular filtration rate declines, the time necessary for half of a drug to be excreted increases by as much as 40%, which places the older adult at risk for drug toxicity. A primary healthcare provider asks a nurse to witness informed consents for several patients. Which patients identified by the nurse are unable to give an informed consent for surgery? Select all that apply. A 16-year-old boy who is married. B. A 50-year-old woman who is confused. C. A 35-year-old woman who is depressed. D. A 50-year-old woman who does not speak English. E. A 65-year-old man who has received a narcotic for pain. The correct answers are B. A 50-year-old woman who is confused and E. A 65-year-old man who has received a narcotic for pain. Rationale: a person who is confused is unable to understand the risks and benefits associated with making an informed decision. Narcotics depress the central nervous system, including decision-making abilities. This person is considered functionally incompetent. A depressed person is capable of making healthcare decisions until proven to be mentally incompetent. The person who does not speak English can provide informed consent after interventions ensure that the person understands the facts and risks with the treatment. Legally, individuals younger than 18 years old can provide informed consent if they are married, pregnant, parents, members of the military, or emancipated.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse completes an incident report after a patient falls while getting out of bed unassisted. Which is the purpose of this report? A. Ensure that all parties have an opportunity to document what happened. B. Help establish who is responsible for the incident. C. Make data available for quality control analysis. D. Document the incident on the patient's chart. The correct answer is C. Make data available for quality control analysis. Rationale: incident reports help to identify patterns of risk so that corrective action plans can take place. Questions of liability are the responsibility of the courts. The nurse who identified or created the potential or actual harm completes the incident report. An incident report is not part of the patient's medical record, and reference to the report should not be made in the patient's medical record. Which factor is unique to malpractice when comparing negligence and malpractice? A. The action did not meet standards of care. B. The inappropriate care is an act of commission. C. There is harm to the patient as a result of the care. D. There is a contractual relationship between the nurse and patient. The correct answer is D. There is a contractual relationship between the nurse and patient. Rationale: only malpractice is a misconduct performed in professional practice, where there is a contractual relationship between the patient and nurse that results in harm to the patient. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The patient must have sustained injury, damage, or harm with both negligence and malpractice. A nurse says, "If you do not let me do this dressing change, I will not let you eat dinner with the other residents in the dining room." Which legal term is related to this statement? A. Battery. B. Assault. C. Negligence. D. Malpractice. The correct answer is B. Assault. Rationale: this statement is an unjust threat. Assault is the threat to harm another person without cause. Battery is the actual willful touching of another person that may or may not cause harm. Negligence occurs when harm or injury is caused by an act of either commission or omission. Malpractice is negligence by a professional person as compared with the actions of another professional person in a similar circumstance when a contract exists between the patient and nurse. Which of the following patients requires a co-signature for a valid consent for surgery? A. A 15-year-old mother whose infant requires exploratory surgery. B. A 40-year-old resident in a home for developmentally disabled adults. C. A 90-year-old adult who wants more information about the risks of surgery. D. A 50-year-old unconscious trauma victim who needs insertion of a chest tube. The correct answer is B. A 40-year-old resident in a home for developmentally disabled adults. Rationale: a person living in a home for developmentally disabled adults may not have the mental capacity to make medical decisions and requires the signature of a court-appointed legal representative. A mother may legally make medical decisions for her children even if the mother is younger than 18 years of age. Older adults can make decisions for themselves as long as they understand the risks and benefits of the surgery and are not receiving medication that may interfere with cognitive ability. The chest tube insertion is an emergency procedure that is implemented to sustain life and does not require a signed consent if the patient is incapacitated. When attempting to administer a 10 p.m. sleeping medication, the nurse assesses that the patient appears to be asleep. Which should the nurse do? A. Withhold the drug. B. Notify the primary healthcare provider. C. Awaken the patient to administer the drug. D. Administer it later if the patient awakens during the night. The correct answer is C. Awaken the patient to administer the drug. Rationale: administering a medication is a dependent function of the nurse. The prescription should be followed as written if the prescription is reasonable and prudent. This medication was not a PRN medication, but rather a standing order. Withholding the drug is a violation of the primary healthcare provider's order. Notifying the primary healthcare provider is unnecessary. The drug should be administered as prescribed, not at a later time. A patient sustained a serious injury as a result of malpractice by a nurse. Several legal elements must be met to prove the nurse committed malpractice in a civil suit. Which statements are associated with the element of causation? Select all that apply. A. A nurse-patient relationship existed between the nurse and the patient. B. A nurse's omission or commission of an act failed to meet standards of care. C. A nurse's action or inaction was the immediate reason for the plaintiff's injury. D. A nurse should have known that the action or inaction could result in harm or injury to the patient. E. A nurse's action or inaction that did not meet a standard of care resulted in a patient experiencing pain, suffering, and disability. The correct answers are C. A nurse's action or inaction was the immediate reason for the plaintiff's injury, and D. A nurse should have known that the action or inaction could result in harm or injury to the patient. Rationale: causation relates to malpractice when a patient's injury is directly the result of a nurse's action or inaction. Causation also relates to malpractice when a nurse should have known that an action or inaction that is a breach of a nursing standard could result in harm or injury to a patient. Answer A and B reflects the element of duty, not causation. Answer E reflects the element of damages, not causation. A hospitalized client tells the nurse that an instructional directive is being prepared, and that the lawyer will be bringing the document to the hospital today for witness signatures. The client asks the nurse for assistance in obtaining a witness to the will. Which is the most appropriate response to the client? A. I will sign as a witness to your signature. B. You will need to find a witness on your own. C. Whoever is available at the time will sign as a witness for you. D. I will call the nursing supervisor to seek assistance regarding your request. The correct answer is D. I will call the nursing supervisor to seek assistance regarding your request. Rationale: instructional directives are required to be in writing and signed by the client. The client's signature must be witnessed by specified individuals or notarized. Laws and guidelines regarding instructional directives vary from state to state, and it is the responsibility of the nurse to know the laws. Many states prohibit any employee, including the nurse of a facility, where the client is receiving care, from being a witness. Option B is non-therapeutic and not a helpful response. The nurse should seek the assistance of the nursing supervisor. A client is brought to the emergency department by emergency medical services after being hit by a car. The name of the client is unknown, and the client has sustained a severe head injury and multiple fractures and is unconscious. An emergency craniotomy is required. Regarding informed consent for the surgical procedure, which is the best action? A. Obtain a court order for the surgical procedure. B. Ask the EMS team to sign the informed consent. C. Transport the victim to the operating room for surgery. D. Call the police to identify the client and locate the family. The correct answer is C. Transport the victim to the operating room for surgery. Rationale: in general, there are two situations in which informed consent of an adult client is not needed. One is when an emergency is present and delaying treatment for the purpose of obtaining informed consent would result in injury or death to the client. The second is when the client waives the right to give informed consent. Option A will delay emergency treatment and option B is inappropriate. Although option D may be pursued, it is not the best action because it delays necessary emergency treatment. Nursing staff members are sitting in the lounge taking their morning break. An unlicensed assistive personnel tells the group that she thinks that the unit secretary has an STI and proceeds to tell the nursing staff that the secretary probably contracted it from her husband, who is supposedly an addict. The nurse should inform the UAP that making this accusation has violated which legal tort? A. Libel. B. Slander. C. Assault. D. Negligence. The correct answer is B. Slander. Rationale: defamation is a false communication or a careless disregard for the truth that causes damage to someone's reputation, either in writing or verbally. An assault occurs when a person puts another person in fear of a harmful or offensive contact. Negligence involves the actions of professionals that fall below the standard of care for a specific professional group. A client admitted voluntarily for treatment of an anxiety disorder demands to be released from the hospital. Which action should the nurse take initially? A. Contact the client's health care provider. B. Call the client's family to arrange for transportation. C. Attempt to persuade the client to stay for only a few more days. D. Tell the client that leaving would likely result in an involuntary commitment. The correct answer is A. Contact the client's health care provider. Rationale: voluntary clients have the right to demand and obtain release. The initial nursing action is to contact the HCP, who has the authority to discuss discharge with the client. While arranging for safe transportation is appropriate, it is premature in this situation and should be done only with the client's permission. While it is appropriate to discuss why the client feels the need to leave and the possible outcomes of leaving against medical advice, attempting to get the client to agree to staying for only a few more days has little value and will not likely be successful. While involuntary commitment is a possibility, it should not be used as a threat with the client.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse calls the healthcare provider regarding a new medication prescription because the dosage prescribed is higher than the recommended dosage. The nurse is unable to locate the HCP, and the medication is due to be administered. Which action should the nurse take? A. Contact the nursing supervisor. B. Administer the dose prescribed. C. Hold the medication until the HCP can be contacted. D. Administer the recommended dose until the HCP can be located. The correct answer is A. Contact the nursing supervisor. Rationale: if the HCP writes a prescription that requires clarification, the nurse's responsibility is to contact the HCP. If there is no resolution regarding the prescription, because the HCP cannot be located, or because the prescription remains as it was written, after talking with the HCP, the nurse should contact the nurse manager or nursing supervisor for further clarification as to what the next step should be. Under no circumstances should the nurse proceed to carry out the prescription until obtaining clarification. The nurse calls security and has physical restraints applied to a client who was admitted voluntarily when the client becomes verbally abusive, demanding to be discharged from the hospital. Which represents the possible legal ramifications for the nurse associated with these interventions? Select all that apply. A. Libel. B. Battery. C. Defamation. D. Slander. E. False imprisonment. The correct answers are B. Battery and E. False imprisonment. Rationale: false imprisonment is an act with the intent to confine a person to a specific area. The nurse can be charged with false imprisonment if the nurse prohibits a client from leaving the hospital, if the client has been admitted voluntarily, and if no agency or legal policies exist for detaining the client. Battery is related to the act of restraining the client in a situation that did not meet criteria for such an intervention. Libel and slander are not applicable here, since the nurse did not write or verbally make untrue statements about the client. While eating lunch in the hospital cafeteria, a nursing student overhears two nurses talking about a client. Which is the important information for the nurses to remember when talking about the client? A. Talking about clients in public places is a violation of the client's confidentiality. B. The client's rights to confidentiality do not apply to the break time of employees. C. It is acceptable for the nurses to talk about a client because they are on the same treatment team. D. The nurses taking care of the client should not share information with each other that the client has told them separately. The correct answer is A. Talking about clients in public places is a violation of the client's confidentiality. Rationale: although it is acceptable for the nurses on the same treatment team for a client to discuss their treatment, it is not appropriate to do so in the cafeteria or any other place, particularly when others could potentially hear this conversation. The nurse cannot violate confidentiality during the professional's personal time. There is not a time during which it is acceptable to violate confidentiality, except in the case of a life or death emergency. The nurse is caring for a client who was involuntarily hospitalized to a mental health unit and is scheduled for electroconvulsive therapy. The nurse notes that an informed consent has not been obtained for the procedure. Based on this information, what is the nurse's best determination in planning care? A. The informed consent does not need to be obtained. B. The informed consent should be obtained from the family. C. The informed consent needs to be obtained from the client. D. The healthcare provider will provide the informed consent. The correct answer is C. The informed consent needs to be obtained from the client. Rationale: clients who are admitted involuntarily to a mental health unit do not lose their right to informed consent. Clients must be considered legally competent until they have been declared incompetent through a legal proceeding. The best determination for the nurse to make is to obtain the informed consent from the client. A client refuses to take a medication. Which is the most therapeutic response by the nurse? A. I'll come back later to see if you have changed your mind. B. You don't have to take the medication if you don't want to. C. This medication is going to help you get better, so why don't you go ahead and take it? D. Do you want me to call your healthcare provider and tell him you won't take your medication? The correct answer is B. You don't have to take the medication if you don't want to. Rationale: the client has the right to refuse medications or any other aspect of therapy. Therefore, the correct option is the therapeutic response. Options C and D are degrading and scold the client. Although option A is a possible choice, it isn't the best or therapeutic one.
You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.